Well, welcome to today's talk, Saturday the 13th of November today. Now, we're certainly heading well into autumn. Now, it's about 5 p.m. here in the north of England, and as you can see outside, it's already completely dark. So we're getting well into autumn. So what's going to be happening in autumn? Well, let me try and summarise what's most likely. Things will rumble on for a bit yet, and when I say a bit yet, probably a month or 2 or 3 in the UK and in the United States, I suspect. I don't think we're going to see surges like we did last year. That's currently what's looking hopeful at the moment. Europe, the picture's not so good. There could well be increases in cases there, and potentially dramatically. And in Russia, the situation is already quite appalling for many people in Russia. Not so bad in Moscow itself, but in all the other 80 provinces or regions of Russia, we believe that the situation is really quite bad, with people seeking hospital care and not being able to get it. So that's kind of a rough summary. Let's just look at some graphics to help us with that a minute. So New Zealand, Canada, Australia, relatively low, thankfully. Then the United States. Now, as we've said, it's autumn, and there does seem to be it's been going down nicely in the States, of course, but there is a slight uptick there. Let's hope that's not significant. And likewise for the UK, very similar really. We've been coming down nicely, but just a very slight uptick in the recent last week or so. So downward trends generally, but Ireland, representing Europe, will see quite a few European countries are going up at the moment. Number of patients in hospital, which is probably most important. Well, United Kingdom, it's still high. It's still quite a few, but United States are down, but round about the same level now per capita. Ireland going up, Canada going down gradually, I think we could say there for Canada. So new daily confirmed COVID-19 cases per million. So this is giving us an idea of the European situation now, which so here we have Germany with an upward trend, and Denmark with an upward trend. The UK, as we've said, slight upward trend over the last week or so. Greece, higher numbers than the UK. Netherlands, higher number than the UK. Ireland, higher numbers than the UK. And Belgium, higher numbers than the UK. And of course, over the next few weeks, these will, to some degree, feed through into increased hospitalisations, inevitably. Not as firm as a link as it was before vaccination, but it's still there. It's become an elasticated link rather than a rigid link. Patients in hospital, again, per million. So this is a hospitalised patient. So Denmark, Netherlands, trending upwards though. That's the thing. Ireland got limited healthcare capacity really in Ireland, trending up. The United Kingdom and Belgium starting to go up now. So quite a few European health services are going to be under quite a lot of pressure for the rest of this year. I think that's probably a fair conclusion to draw from that. Now this is the R value, which is quite interesting. Now this is R equals 1 line here. So in other words, below that line, the numbers are reducing. So we see that in Australia and the United Kingdom, the numbers are reducing. Canada and the United States, just on the upper side of that positive line at the moment, just slight increases. But then we go to Ireland, Greece, Netherlands, Denmark, Germany and Belgium. And if we look at Belgium here, well, that's well above. That's about the 1.5 line that Belgium's on, which is really quite a high rate of increase. So we see quite a few increasing cases as we look around Europe over the next few weeks. So that is that trend there. Now let's look briefly at the United States now, I think. Here we have the United States, I think we do. So daily cases in the States, well, as we've said, going up very slightly over the last week or two. Could go up some more as we go into autumn. Deaths in the United States have remained actually stubbornly high, have come down quite a bit lately though, which is good to see. And then hospitalisations in the States, this is by age. So as we see, a downward trend in hospitalisation, nothing like it was last winter. It's been a bad early autumn. As we go into later autumn, there we are trending downwards. Top line there is over 65s, and then the 50 to 64-year-olds and going down in age groups with hospitalisations, of course, as we would expect, as thankfully fewer younger people are hospitalised. Now, US, so that's the deaths and cases in the United States. Click on it for yourself. That's hospitalisations. Now, interesting in the States, COVID vaccine booster doses available for all adults. California has just gone this way. So basically, if you're over 18 in California, you can almost certainly get a booster shot now. Colorado, New Mexico are ready. Moving ahead of the government, which is just advising booster doses for those more at risk. This will apply to the over 18s 6 months after the second dose, at least in these states at the moment. So we are seeing really, we've probably been seeing it for some time now, but really quite a split in the federal policies in the United States compared to the regional ones. I think it's probably fair to say. Now, I want to go on now and look at some of the UK data. We'll start off with some Zoe graphics link, and then we'll look at some Zoe COVID symptom tracker data. Now, here is the live. This is the live site here at the moment. So we see there's about just over 1 million symptomatic cases of COVID in the UK from the COVID symptom tracker data. Estimated to be new daily cases 65,000, so still pretty high, And that's the trend there. Thankfully, the symptom trend is still going down. It hasn't showed the uptick that the official cases have. Now, I want to actually look at some of the COVID data in a little more detail. So we have that here. Most useful weekly data from the COVID symptom tracker study. Now, this is the study UK incident figures, so incidents and new cases over time, total number of new cases and new cases in the fully vaccinated. So we do see a slight downturn in cases overall, but a slight ongoing increase in people that are fully vaccinated. So, you know, this is just an immense disappointment. These are fully vaccinated people still getting symptomatic infection at quite a reasonable rate. Now, nothing like as high as the unvaccinated, of course. Nothing like as high, but still remarkably disappointing. We'd hope that the vaccines would be much, much more effective than this in preventing symptomatic disease, and they're simply not. Disappointing. So this is the trend in hospitalisations, which is actually down slightly. So this is the UK trend in hospitalisations. So thankfully we are starting to see this go down a little bit in hospitalisations, but of course it's quite early to tell that. But generally speaking, this data is the most up to date, although this is about a week old now. The live data is the most up to date. Incidents by age group. So here are the age groups in the UK, which I've forgotten to put the key on. I know the key is up there. It is there. So these are the 0 to 18s. So that's starting to go down a bit. The green is their children's parents' generation. This is the 35 to 55. Then the orange here is the 18 to 55. The red is the 55 to 75, and this is the older age groups here. So basically what we're seeing is an increase in the age group of the parents. Not in the age group. In the age group of the parents, we're seeing a slight increase in cases, but in the younger age group, the children, a bit of a downward trend, at least in under 18-year-olds. Nationally, who's leading now? Well, Wales, I'm afraid, is at the top there. And what's the next one there? That looks like the southwest. So I'll put the links there if you want to look at these in detail. They're always there. Predicted long COVID, ongoing problem. This is predicting basically 1,500 new cases of long COVID at the moment every day. And how long these will be is probably for most people around 12 weeks, but for some it's longer. So always pretty useful data there from the COVID symptom tracker study. And we'll just have a quick look there at the live data again. That was the live data from there. That's straight from the website there. Okay, let's look briefly now at the UK summary data. Here, as we've said, cases. I've just showed a slight up blip lately, and we've already looked at the hospitalisations. Let's just check on the deaths in the UK situation. Well, I think rumbling on it is the answer there. These are not insignificant, and of course the total number of deaths ends up being the complete area under the graph, so it's still there. So if we look at the data, 157 deaths in the last day, 24 hours, just over 1,000 deaths from COVID, with COVID on the death certificate in the last week. So no cause for complacency really at all. So anyway, there's all the links there. Now, what's going to happen next in the UK? Of course, that's the interesting question. Now, Professor Neil Ferguson, let's just say Professor Ferguson's had a bit of a mixed record, but he is privy to a lot of the data that a lot of us aren't able to access readily, at least. He's saying catastrophic winter wave like last winter is unlikely, so that's good. It's not going to be as bad as last winter. Nothing like as bad, we don't think. UK is in quite a different situation from other European countries, as we saw Germany, Netherlands, France, with increasing cases. And the number here, the reason for this, strangely enough, is that the UK has had very high cases over summer. So it looks like the low European cases are now catching up in autumn, which of course is when you don't want them to catch up, because this is when we can have the major strain on the hospital system. So in the UK, we've had a bit of a strain on the hospital system for a long time, as cases have been rumbling on, but Europe seemed to be getting it all at the same time, all at once. So high COVID numbers in summer gave the population a bit of an immune boost. Now, people don't talk about herd immunity anymore. We might be looking at that again tomorrow. There's some new material out from that on the Centres for Disease Control on the lack of herd immunity in the United States, it has to be said. But we'll just notice that we do have more community immunity there for the time being, because we've had 30 to 50,000 cases a day for the last 4 months. So Neil Ferguson, I think it's unlikely we'll get anything close to what we had last year, that catastrophic winter wave, so we're pleased to hear that. And I agree, I think that is completely consistent with what we've been saying actually on this channel for some months now, that this is likely to be a bit of an up blip now, but we're hoping for quite a dramatic improvement. At least I'm still hoping for quite a dramatic improvement early into next year, fairly early into next year. Several weeks of declining cases, a hint of uptake in the last few days. Well, we did see that. In fact, we've got the graphic for that there, so always good to double check these things, and we do see that slight sort of increase just there. Let's hope that this is not going to, well, we don't think this is going to progress and become bad. We don't think it is. Russia. Well, things do appear to be pretty appalling, really. I mean, that's the official cases. That's the official deaths. The real numbers aren't going to be that. Now, there was 80 regions, which is, I think, how many regions are there in Russia? I think it's about 85 or so. It's just over 80, 85, something like that. I'm not really sure. Just over 80, I think. But most areas in Russia have had a 1-week workplace shutdown. Now, that is a dramatic step, really dramatic step for the Kremlin to take, and yet they've taken it, but the numbers are still pretty high in Russia. So Russia is actually in a pretty bad situation in many places. Now, some of you watched my video where I was fact-checked recently, and of course we fact-checked the fact-checkers, because we don't take the word of fact-checkers for facts. So I thought I'd do a bit of a fact check myself. So this is from an article from the BBC. So this is just to see how this works out. COVID Pfizer says antiviral pills 89% effective in high-risk cases. So let's do a bit of a fact check on this article. And the article is there, but I can't really show you because there's copyright problems there. So, but anyway, this is about this BBC article. And they didn't do too bad. It's not as bad as it sounds. So this is the article. Antiviral pill, 89% effective in high-risk cases. Now, this does seem to be an accurate figure. This does seem to be a remarkably effective antiviral. We looked at this. It works by inhibiting the It works by inhibiting our old friend now, the three chymotrypsin-like protease that chops up the long proteins. It binds these up. This one's become unbound. It's become liberated. So a bit of a dangerous pair of scissors there now. But it does. That's how it works. So it comes a day after the UK medical regulator has approved a similar treatment from Merck. So this is the release from that. So this Merck thing was approved last week. This Merck medication was approved somewhat surprisingly quickly. So more to come on that. Pfizer says it stopped trials early as the initial results were so positive. So that's good. So Pfizer stopped the trials early. Then the BBC says the combination treatment, which is still experimental because trials haven't finished yet. So it's just a minor point, but the BBC is there contradicting itself. It says the trials are finished and it says the trials are ongoing. So the fact checkers picked me up on plenty less than that, that's for sure. UK's ordered 250,000 courses of Paxlovid, which is the new Pfizer antiviral in combination with the well-known ritonavir, which is a native medication that goes back to 1996. I'm pretty sure that first came out, so that's not new. Also one of these protease inhibitors, so it's two protease inhibitors together. Cost, we have no idea. I can't find how much the British government has paid for this. We simply don't know. The Molnupiravir, the Merck one, well, 480,000 courses of that have been ordered, and we know that in the States was $700 a course. So not cheap by any means. Fluvoxetine. Why aren't we using fluvoxetine? I mean, we did a study on this a few days ago, and fluvoxetine does seem to be very effective. It's a generic selective serotonin reuptake inhibitor. I think it was about $3 or $4, about £3 per course. Why aren't we using that? Why have we jumped straight onto these? Well, I think it has to be said new, if not experimental, might be too strong a term, but still new antivirals. Why aren't we using fluvoxetine that we know we've had a safety record on that since SSRIs first came out, whenever that was? Oh, I don't know. Must be at least 30 years ago. Anyway, they say Paxlovid works in a slightly different way to the Merck pill. I'm not going to accept that. It works in a completely different way. The Paxlovid is a protease inhibitor. This puts in a kind of bogus RNA base that causes mutations. To say it's slightly different is misleading. And that's what I got fact checked on. Let me know if I got that. I got fact checked on being. Oh, that's right. Here we are. Independent fact checkers say this information could mislead people, so we don't want to mislead people. I wonder if these philanthropic fact checkers will be fact checking the BBC. Well, no sign of it so far. Which introduces errors into the genetic code of the virus. So I stress that this is not the Pfizer one, this is the Merck one. Full trial data has not yet been published for either company. Now, until I make some decision on these, I want to see the full trial data. To tell you the truth, I am not happy with a press release from the company or companies. And I'm not even happy with the British regulatory authorities approving this without releasing the peer-reviewed data, although we have to take their word for it. We are expecting it to appear on the NICE protocols pretty soon, even though we don't seem to have the other drugs that have demonstrated efficacy. Pfizer chairman, chief executive, the potential to save patients' lives reduces the severity of COVID-19 infections and eliminate up to 9 in 10 hospitalisations. Well, that is, from the data we have, that is actually true. It could do that, but we have presumably cheaper alternatives that could potentially do something similar-ish. So why we're not using those, I don't know. But as we say, the British government's bought 250,000 of these already. They have been successful, notably in HIV, but reports conclude one antiviral flu ending up being about as effective as paracetamol. So this was the comment here now. So there've been success, notably in HIV, but reports conclude one antiviral for flu ended up being about as effective as paracetamol. Now, this gives the impression, so paracetamol in the States is acetaminophen or Tylenol. This, I think, is misleading because we don't want to be misleading, as the fact checker said, we don't want to be misleading. And the way I think this is misleading is it intimating, you decide for yourself, is it intimating that paracetamol is antiviral? Or acetaminophen or Tylenol is antiviral? Let me be completely clear. Paracetamol, acetaminophen, Tylenol is not antiviral. It's a painkiller and it reduces body temperature. It's not antiviral. And if you take these temperature lowering drugs when you have acute infections, there's a big body of evidence suggests quite strongly that reduces the overall efficiency of the immune system. So I think the BBC is being a bit misleading there. So I'm going to give that one a cross for being misleading. But of course, if the BBC wants to come on and argue the point, they are more than welcome. So there you go. I think overall what should we give the BBC for that as an overall? Not bad, actually, not too bad. I think I'll give them I'm a bit struggling really. Let's say a 6 out of 10. Could do better, but not too bad, but somewhat misleading. So 6 out of 10 for that for the BBC. So there we go. Maybe everyone's going to start fact checking now. I do hope I haven't started a new trend, but. Of course, this is written by journalists, you know, and loads of you said, come to think of it, I've had a bit of a stiff neck lately. I must go and see my journalist to see if I can get some treatment for it. Right, okay, enough of that. Let us get a report. Now, this is a report from Chris in California. Now, the first report he had about getting aspiration for his own personal vaccine was very positive. He's since had another experience which is not so positive. So, Chris, thank you very much. And over to Chris now in California.
Hello, Dr. Campbell. Chris here again, California. I'll make this brief, but I wanted to give you an interesting update. I'm a little bit taken back by this. Today is November 9th, and I just took my son to get his first vaccine at the local CVS over here. Not the same one that I went to for my booster, because they weren't giving out this particular one wasn't giving out the Moderna one. And I had a really unsatisfactory experience. Everybody was super nice, but I expressed to them the same concerns I had about when I got my booster, and I said, if you would do this for me, it'd be really helpful if you can aspirate the needle before you give it to my son. And they would not do it. They said that there is no way that they do intravenous shots and it's guaranteed. And I said, it's not guaranteed unless you can aspirate the needle to check and see if you've hit a vein. And they said quoting them, it is impossible that they could ever hit a vein or vessel. And I said, that's not exactly true. And they said, no matter what, I said, medical professionals know this is the right way to do this for intramuscular injections. And they said, regardless of what you think, it is not the policy. It is not the CDC's policy. So therefore they are not allowed to do it. And I actually was going to take my son out, but my son's mother, who was with me at the time, pretty much trumped my decision, and they did it anyway. So again, not the best experience. I'm really, really upset about it. But he seems to be doing fine, and I'm hoping for a good outcome. So again, that was just another quick little update from this side of the pond. I hope you're well. Thanks.
Thanks, Chris. If I can get back into the picture here. Yes, there we are. Yeah, thank you for that, Chris. Very interesting and massively disappointing. So they don't give intravenous shots. So they say, well, they don't know whether they're giving intravenous shots or not because they don't check. They completely refused a patient request, or in this case, the father of a patient. And that means that they completely failed to achieve concordance. And in healthcare, we should achieve concordance for all our treatments. They said it was impossible that it could go into a vein. It's not impossible, it is possible. They said it was the CDC policy. Two things there. Okay, if it's the CDC policy, you can still, I don't see why you can't aspirate, but in the UK we'd call that a bit of a job's worth situation, or it's more than my job's worth to do that, mate. We have to follow the policy. So, but there again, people do have to follow policies, I suppose. So what this means is the policy needs to change. The change has to come from the top down to introduce aspiration into this procedure. Anyway, Chris, I'm delighted that your son is okay, and of course it's overwhelmingly probable that he will continue to be absolutely fine. But still a difficult experience for any parent, and one that quite honestly you shouldn't have been put through, because concordance should have been harmoniously achieved by the staff, which is what healthcare providers are supposed to do. So that would be my view on that, and thank you very much, Chris, and thank you for watching.